After bringing the equipment, I'm going to perform the proper hand washing. Assuming that I'm done with the proper hand washing, I am now going to go to the client. Hello ma'am, good day.
Good day.
I am Shanedy Sumagang and I am your nurse for today. May I know your name, ma'am?
Shanedy.
Okay, may I see your name tag please? Shanedy. So I'm just going to close the door and the curtains for privacy, okay? So what we're going to do is an assessment for an older adult. I am going to examine your body by inspection, palpation, and auscultation. So I will be looking at your appearance and sometimes I am going to be touching you. But don't worry because I will inform you beforehand each time the procedure will be performed, okay? So we're doing this to know if you have the signs and symptoms that might indicate a medical condition and also to aid it accordingly. Also, we're doing this for us to know what health needs are important for you to have right now. Isn't it better to know it early, right ma'am?
Yes.
Do you have any questions, ma'am?
Nothing.
If you have any questions later during the duration of our assessment, please feel free to ask me, okay? Okay, so now I'm going to start. First is your skin. As I can see, your skin color is white and generally uniform. There are no birthmarks and no visible moles. But I can see pigmented spots in your sun-exposed areas. Okay, now I'm going to palpate your skin, ma'am. So I'm going to touch you. Is that alright?
It's alright.
Okay. Okay, so for the skin moisture, dryness can be felt and you also have poor skin turgor.
Is that bad?
Although dryness can affect anyone, it's particularly common among older adults. Aging can make your skin susceptible to dryness. And also with age, your skin loses elasticity, causing poor skin turgor. Okay, so that's all for the skin, ma'am. Now let's proceed to your nails. May I see your nails, ma'am? Your nails are really smooth. You must have taken good care of your nails, ma'am.
Yes.
Because usually, nails like this are rare in your age, ma'am. Okay, so the shape is round and the color is whitish with a hint of purple and yellow. So that's all for the nails. Now I'm going to proceed to your head. So first is your hair, okay? See? Okay, so your hair is evenly distributed, light colored. The white color is relevant. And also, it is silky but thin. A good thing is that there are no infestations like lice. Now, I'm going to palpate your skull and also inspect it, okay? Is there any pain, ma'am?
None.
Okay. So, your head is rounded, normocephalic, and symmetrical with smooth contour. Also, there are no masses and no nodules and no lesions and, of course, no tenderness. Okay, so now I want you to wrinkle your forehead or just raise your eyebrows. Okay, now close your eyes tightly. I'm gonna open. Now, puff out your cheeks like this. Okay, thank you. Now smile broadly with your teeth showing. Okay, thank you. So I see no facial movement asymmetry. Now I am going to proceed to your eyes, ma'am. Okay? As I can see, your eyebrows are evenly distributed. Now I want you to close your eyes, ma'am. And then open. Okay, so your eyelids closed symmetrically and there's no drooping. Now I am going to check for the conjunction of your eyebrow reverting your eyelids, okay? Look down. Look to the side. Other one, look down. Now look to the side. Okay. So there's no problem at all. It is just that it's not so shiny and the color is red but pale. Now, I'm going to check for your cornea. Okay, I'm just going to use this pen light to see clearly, ma'am, okay? Other one. Okay, so also there's no problem with your cornea. It is just that it is not so shiny and it is clouded, but only a little bit. I won't even notice if I didn't look closer. But there's no problem at all with that. And also your pupils are black in color and rounded and equal in size. Now I am going to check your eyes reaction to light, okay? So I'm going to use a spotlight with its light on. I'm going to pass the light on your eyes, okay? I just want you to look straight now, okay? One. Okay, so your eyes are reactive to light. Your pupils constricted when light passes on it. Now for the pupillary accommodation, I want you to look straight away for now. Now look at the spotlight as I bring it closer to you. Okay, so what I found out is that when you looked far away, your pupils dilated, and when you looked at this thing as I brought it closer to your nose, your pupils actually constricted and converged, which is a good thing. Now I am going to show you some letters and I want you to speak it out as you read it, okay?
M, P, C, L, P, Q, Z.
Okay, thank you. So you read all the letters correctly. Means your vision is still good for now. Okay? Now, I am going to proceed to your ears. Okay, so your auricle's color is the same with your facial skin color, and also it is still a bit elastic. Now for your hearing acuity, I am going to say some words and I want you to repeat after me, okay? First, cover your right ear. Apple.
Apple,
Dinosaur.
dinosaur,
Okay, thank you. Now cover your left ear. Dragon.
dragon,
Lizard.
lizard.
Okay, thank you. So you repeated all the words correctly. Now I'm going to conduct a whispered voice test. So I'm going to be standing behind you 2 feet away, and I'm going to whisper some words or numbers, and I want you to repeat it as I say it and as you hear it. So I'm going to use a whispered voice, okay?
Okay.
7,
7,
8.
8,
Now cover your right ear. 4,
4,
9.
9,
Cover your left ear. 6,
6,
2.
2.
Okay, thank you, ma'am. So you actually repeated all the numbers correctly, which is a good thing. Now, we will proceed to your nose. So, as I can see, your nose is straight and symmetrical, but there is a little bit of drooping. Good thing is that there is no visible charges and the color is the same with your facial skin color. Now I am going to palpate your nose, ma'am. Is that okay?
Yes.
Is there any pain, ma'am?
None.
Okay. So there's no tenderness and there are no masses. Now I am going to occlude one side of your nose, ma'am. Is that okay?
Yes.
Now sniff. The other one. Okay, so there is no restriction in the air movement in either of your nares. Now, so that's all for your nose. Now let's proceed to your mouth and oropharynx, okay? As I can see, your lip color is light pink and uniform. Now, I want you to let me see your gums. Okay. Now, open your mouth and let me see your teeth. Now your tongue. Is there any pain, ma'am?
None.
Now move your tongue. Okay, now say ah. Stick out your tongue. As I can see, your gums recede could be due to old age, and the color is generally pale. And also your teeth are yellowish, and I can see one tooth with a cavity. For your tongue, it is position centered, and also there's no tenderness in your tongue, and the movement is free. Now for your oropharynx and tonsils, the color is light pink, and the posterior wall is smooth. Now I am going to proceed with your neck, ma'am, okay? So the muscle is equal in size and your neck is centered. Can you move your head down like this? Okay, thank you. You can go up now. Your side. Try the other side. The other side. Okay. Is there any pain, ma'am?
A slight pain, but probably because I haven't stretched for a while now.
Okay. Okay. Now I am going to palpate your thyroid, okay? Is there any pain?
None.
Now I'm going also to palpate the tonsils near it, okay? Is there any pain, ma'am?
None.
Okay, so there's no tenderness. Your thyroid is smooth and there are no masses or nodules anywhere near it. So now we are going to proceed to your thorax and lung. So I will give you this drape because I am going to look at your chest now, okay? So I'll just cover you up. So you may also use this, ma'am. Okay, so I am going to look at your thorax, ma'am. So may I? Okay, so skin is uniform in color, and your thorax are symmetrical and equal in size. Now I am going to palpate your thorax, ma'am. First is your anterior. Is there any pain, ma'am? For your posterior thorax, I will pick up my hand. Is there any pain, ma'am?
None.
So your skin is intact. Now I'm going to put my hands here and I want you to breathe deeply. Okay? Inhale. Exhale. Okay. So, okay. The movement is symmetrical. Now I am going to auscultate your thorax, ma'am. Okay? Just breathe. Your thorax. And on. Okay, so I didn't hear any wheezing or crackle. There are only normal breath sounds. You may feel comfortable there for a minute. I'm just going to record some things, okay? Everything okay, ma'am?
Yeah.
Okay, so actually I just recorded the numbers of respiration, ma'am, and you had 18 respiration in a minute. Now we are going to proceed to your abdomen, ma'am, okay? So I want to see your abdomen, ma'am. What I saw was that your skin is wrinkled, but the color is uniform. Also, there are no visible blemishes, and it is flat. Now I am going to auscultate for your bowel sounds, ma'am. May you please lay down in a supine position? Bowel sounds are audible. Now I'm going to palpate for your liver, okay? I can't really palpate your liver, ma'am. Okay, now you can please sit back up. So for the musculoskeletal, ma'am, I am going to observe your appearance. May you please stand up? Can you walk 2 steps to the front, ma'am? Is it hard for you or not?
Not
Okay.
really.
You can sit back down. The musculoskeletal is equal in size for both sides of your body. Now I am going to palpate your bones and your joints, okay? Is there any pain, ma'am?
None.
Just tell me if there's any pain, ma'am, okay? There's no pain, ma'am. For your joints, there are no swelling and also no tenderness and no masses. For your bones, there are no swelling and also no tenderness and no masses. So that's all now for the assessment. I am going to inform you if there are any further instructions after I report my findings. Okay? So you may now dress comfortably, rest, and feel comfortable. Thank you, ma'am. So after recording, I am going to perform the hand washing. And that's all for the assessment for an overview. Thank you.